While Zimbabwe is yet to record any cases of Mpox as the viral infection spreads across the world, health experts fear second-hand clothes and accommodation facilities such as lodges and hotels are potential super spreaders. Mpox is a rare viral infection that is endemic to Central and West Africa, but a latest infectious strain has been reported across Europe. That new strain in Europe brings to the fore the second-hand clothes, popularly known as mabero, into spotlight. And the second issue is just how thorough are lodges and hotels when doing laundry. Mpox spreads through close contact with people, animals or material, thus include bedding and clothes infected with the virus. To understand these issues more, we are joined live by public health expert Itai Rusike. Good evening to you, Itai. Now, the world is faced by yet another pandemic while still recovering from the devastating effects of COVID-19. So just how much information is out there on Mpox?
Yes, we definitely need to address, the information gap. There's need for enhanced, health education, health promotion, and we also need to have enhanced, community awareness campaigns and public, awareness activities, so that the general public is well informed, about Mpox, and in terms of its symptoms, and also in terms of how the population, can prevent themselves from this, new outbreak. Community participation is very key, mainly because it also brings, community ownership, in terms of whatever programs that will be carried out, to give people, information. We may also need to identify, community champions, be they religious leaders, political leaders, even any other community leaders.
Right, so Zimbabwe has a huge market for second-hand clothes, yet we understand Mpox can be spread through materials. How huge is this risk?
There are so many ways for Mpox to be spread to people from contaminated sources. We hear that if we don't address issues of high levels of hygiene, we can also get Mpox from contaminated bedding, which also poses a challenge in that so many other people frequent, be they lodges, where sometimes you are not sure about the levels of cleanliness of bedding in those lodges. Similarly, Zimbabweans, majority of us also rely on second-hand clothing, mabero, and we know that it's a source of income, to a larger section of our community. But sometimes we don't even know the sources. Where are these maberos coming from, the second-hand clothes? And given the fact that Mpox is now spread not just to Africa, but to also the source markets where most of these maberos come from, the rich Western countries.
Itai, before I let you go, what should the government do to ensure that we are not caught off guard?
Obviously, to learn from the COVID-19 experience, where we were able to mobilize, our own domestic, resources, and we need to make sure that we strengthen, our surveillance, we strengthen our monitoring, especially along the porous borders. We need to also strengthen our diagnosis, and we need to strengthen our contact tracing and tracking. We also need to make sure that the health workers are well equipped. This is a fairly new disease, So health workers also need to be given all the necessary updates and information on how to respond to this Mpox, and they need to be equipped with all the necessary skills. But most importantly, let us use this opportunity to mobilize our own resources so that we move away from the over-reliance on external partners for support.
Now, that was public health expert Itai Rusike helping us understand Mpox and the risks faced by Zimbabweans, even though the country is yet to record a case. Now, to get more insights on the virus, we are joined live by Dr. Nomathemba Gavumende, a health expert. Noma, good evening. What are the primary modes of transmission for Mpox, and are there any specific situations or activities that increase the risk of transmission?
So usually, the first case, obviously, let's start with that, was from a monkey to a human. So a human got in contact with infected monkey that had the monkeypox. So now what happens is when a human gets in touch with another animal, for example, other animals as well include rodents. Those are the ones that have also been known to also carry the Mpox. But also the largest one that we're having at the moment has been skin-to-skin contact, meaning that a human will get in contact with another person that has Mpox. So for example, I will use Congo. So Congo right now, the places that have a lot of the pandemic has been camps whereby a lot of people are staying in a very small area. So that way a lot of children, because honestly, at the moment, actually, a lot of the kids are the ones that are contacting the Mpox. So you realize, like, when kids are playing together, they will be touching each other and so on. So that way, the transmission has been done, and also through air. So sometimes you might not necessarily have to touch an infected person, but being in the same area make you prone to actually getting Mpox as well.
Right, so how contagious is Mpox during the incubation period, that is before symptoms appear, and are there any measures that can reduce the risk of transmission during this time?
From the previous cases that have been reported all over the world, the incubation period has not proven to be a dangerous period, or it has not been contagious, should I say, but rather it has been when the symptoms have appeared, especially when it is being presented by fever and skin lesions. So some of the prevention measures that the world is using at the moment has been, number one, public health awareness through the public workers that are in infected areas, mostly right now. And secondly, it has been through isolation, which is being used by South Africa for their cases, whether it is home isolation or whether it is within the hospital itself, so that people will not be prone to actually now spread the disease itself. And thirdly has been through the vaccines. So the vaccine has been coming through WHO, which started about a week ago. Some people feel that it is a late call, but it is better late than never. And obviously, as we all know, we need to also be aware of other people that might be presenting some of these symptoms.
Konapo, ipapo pa ZTN Prime, DSTV channel 294, the place to be.